discussing the female genitourinary and rectum assessment. As always, I would start by asking the patient's name and date of birth, as well as performing hand hygiene upon entrance of the room and introducing myself as well. I would then go into asking a couple questions to the patient. This would include past medical history such as recent urinary and kidney infections, kidney stones, constipation and diarrhea, hemorrhoids, menstrual history, menopause history, history of sexually transmitted diseases, as well as past surgical history. In the areas that we would be assessing today, which would be the rectum and the genitourinary systems. I would also ask any family history up to one generation on the maternal or paternal side. This would be focused mostly on renal calculi and cancer in this area. I would ask any medication history, such as allergies and reactions that we need to be aware of, as well as any current medications the patient's taking at home. And then I also want to ask about social history, such as smoking, drinking. If so, how much a day, how much a week, giving me an estimate on where the patient is with those things. Any illicit street drugs, residency conditions, highest level of education, occupation, nutrition, and exercise. And then I'm going to go into the labs that the patient may need to go through, or lab results that the patient wants to review, and any diagnostic studies that might need to be performed as well. Then I'm going to ask the patient about menstrual cycles, menopausal symptoms, any breast self-exams that they might be giving themselves, making sure our patient is well versed in what to do and what they're looking for and what to report. The last mammogram, if the patient has had one, and the last gynecology visit, as well as the last pap test and the results they received from that, and any urinary symptoms they may be experiencing, any vaginal discharge, odor, itching, previous or present lesions or sores. And then we're going to go into sexual preference as well as sexual activity and contraceptive use for sexual activity, as well as any sexually transmitted infections they may have been diagnosed with in the past. And then we get into the objective data. So we're going to percuss the costrovertebral tenderness and report any tenderness if noted. Then we're going to palpate the bladder for distension and report distension if we feel it. Then we are also going to inspect the external genitalia for changes such as lesions, drainage, any color alterations, masses that we see. And then we're going to also palpate the external genitalia for any tenderness and note any tenderness, where it's felt, etc. And then we're going to inspect the anus as well, see if we see any discoloration, masses, any drainage, lesions, anything of that sort. And then always answering any questions we can and educating our patient with pamphlets, brochures, anything that we can so that they know how to perform certain things like breast self-exams and other things on themselves while they're at home.